Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. Here we have Maisie. I did it right this time.
That's
and that's perfect. You know, she came in with her husband, and they've been receiving care. And I just wanted to share with you what I do in the process of adjusting people when they come in for whether it's back pain, neck pain, and predominantly headaches. A lot of those. So let's have you go face down, and then she'll give you her opinion of what her experience was here at the office. I'll be careful of the mascara, for sure.
Okie dokes.
All right, let's have you go ahead and raise your right leg for me. Don't bend the knee though. And back down. Other one. Back down. So when chiropractors do this particular test, it's called a sacral leg test, and they're testing mainly to look at the lower pelvis. This is one approach, but the sacrum. And the sacrum bone will typically tip to one side or another, and so people won't be able to raise the legs. Well, there's a plexus of nerves that branch out from here called the sacral plexus, and able to do that movement or motion in there. We also look at the legs to see how much shortness is in the legs, and we're looking at one discrepancy if it's measured like anatomically, born like that, neurologically when the nerves are pinched, it shortens up on the muscles, or a combination. She has about a 1/2 inch. So not a significant difference like I see. I'll see people with inch, inch and a half, even quite extreme. And then we're talking about different levels of care that I pursue, but she responds fairly quickly to her treatment, comes in as she needs to. But we'll see a lot in the upper neck and head area when we start working with that. All right, turn your head to the left. Turn to the right. And back to the middle. Okay. So we're going to adjust first the pelvic area. Table's going to drop underneath. Simple, easy approach. There's many ways that chiropractors adjust the lower back. And the pelvis is part of the lower back. A lot of times patients will, point to the area where they feel the most discomfort or pain, either in the center, off to the side, or across. Okay, she's about a 1/4 inch off now. Big difference there. We're going to bring the sacrum over, left to right. Go ahead, raise this leg for me. Back down, this one. Back down. Motion's still good. Good, both legs even. And back down. I like to use the drop piece. I also put people on their sides to adjust that joint, but this isn't her major area of complaint right now, or at least I didn't think it was. But a lot of people will experience pain right in through the SI joints. They'll call it typically sciatica. That is not sciatica, but SI or sacroiliac, and they'll feel real tenderness right through this area here. All right, put your right hand lower back for me. Your other right hand. Are you laughing yet? Switch hands for me. And look at the difference in the leg length. So she went from a shorter leg with this isolation test to this one right here. We're going to adjust her lower back right at L4. So lay on this side for me. And she does a lot of tag teaming with Daniel. He's out in the car with the kids, right? All right. L4. Breathe. Thumb. I'm all right. I'm really all right. It's like one of those graceful falls when you go down and then you get up and you have a smile. Really okay. Yes. Where's my chiropractor? Face down for me. I like to use a traction table. It's a distraction. It actually opens up the back portion where the facets or the joints are, as well as where the disc is. Stretches the muscles and tissue right here. There's different angles and degrees of traction that you can do with someone, but this, I tend to keep it a little lighter on someone just to get a nice good stretch in that area. Open up the nerve pathways right through the lower back. Take a deep breath and release it out. All right, big breath in. And we're going to repeat that a couple times. Breath in, Blow out, lift your head. Thank you. Last one, breath in. Blow out, lift your head. Good. Lifting of the head helps relax the tissue so I can get into this area. This is a area that a lot of people hold a lot of their stress in. So right around T1, 2, 3, and 4, those areas can be a little more challenging to adjust on some people. So I'm using this on the areas of the muscle, on the soft tissue. You okay? Are you ticklish?
Yes.
All right, go ahead and lay on your back, please. And then I'm gonna have you switch, Lisa, if you would come back over here. Good. All right. Any headaches or migraines since the last visit?
Yep.
How many?
About 3 days worth.
Has it been getting better overall?
Yes. It just, I think I slept wrong.
Now, are you using a cervical pillow?
No.
Good job. So then, do just a light traction in through here. Breath in and out. So when I adjusted her, I definitely felt more heat come into that area, more blood flow to that area. I mean, you felt warmer as soon as
My
that happened.
face,
Yeah.
yeah.
So what happens is when especially the upper atlas bone is out of alignment in the neck, people will complain of headaches, migraines, dizziness, loss of balance, a whole different array of symptoms that come from that. Because it's the number one area in the spine. Some of the chiropractors only adjust that area alone. That can affect your entire body and ability to move, to function, to breathe, for the heart to beat. Comes from right up into this area here. So when that area is restricted, sometimes people know of a particular cause, like an injury, a motor vehicle collision, fall into their head, some type of brain trauma that could have happened in the past. Other times it's like, what I'd say is repetitive habits or repetitive motions, people sitting on their phones forever, to sitting at a computer, to sitting at a desk can cause that area to misalign. And do you feel the difference of how that's moving in through here now?
Mm-hmm.
Good. So at Maisie, one of the things, we might want to start talking about is getting a cervical pillow when you sleep at night to support the neck. So when you sleep at night, you want a pillow to support underneath here. If you sleep on your back or on your side. Pillows are not intended to be there for necessarily your head, but to actually offer the supports to this area. Good posture. Okay, so we're going to actually adjust the mid-back area. Cross right here. Big breath in. Blow out. Good. I'm going to have you sit up and face that way for me. Good. How you doing? You okay?
Yes.
All right, guys. I was gonna say goodbye, but we're still here. All right, sit up nice and straight for me right here. Shoulders back, and we're gonna bring chin back like that. So her posture, you want to see the ear in alignment with the shoulder, in alignment with the hips. I do this with patients to make them more aware of what's going on in their posture, so they can leave here and feel better, help the adjustment last longer. Breath in through the nose, out through the mouth. I'm going to bring your hair to the side. Breath in, into the nose, out through the mouth. All right. Bring your shoulders up toward your ears. Relax. Good. All right, so the one thing to do if you're getting those migraines, anytime you're starting to feel that stress coming on, simply put your hands behind your back, shoulders back, extend the head back, extend the hands back to help bring that posture, bring your neck curve back into it. So if you're working with the kids, you're on the computer, whatever you are, or texting, you lose that curve, and this is where the stress is coming from out here. So that'll help a little bit more. I mean, there's a whole array of things to do, but we can start with that simple things. It's like in the dojo. It's all about basics. You go back to the basics, even when think they're going to get all fancy with their moves. It's all about basics. You know. All right, guys. I'm Dr. David Warwick. Anyways, do you want to share anything?
Oh yes, I love coming here. I've always been a chiropractic patient, and I had not gone for a very long time. My migraines have gone really bad. I am a mother of two. I breastfeed also, breastfed both my boys. So this posture thing that he's talking about, it's crazy, but it does affect me. And as far as my neck, it has caused me a lot of migraines. Ever since I've been here, I have not taken any medications, very little headaches. And every time I come here, my headaches go away, and if I even have any nick or any discomfort, I always leave here happy. So I love them. We love them.
Have you ever felt like, and this is one of the things that people want to know out there, especially with chiropractors, have you ever felt at any point in time that you were trying to be sold into some type of care?
Oh no, not at all.
And
we come
that's
here,
one of the
like
things.
we call him, can we go over? So
Yeah.
yes.
Absolutely. I'm Dr. David Warwick of Warwick Chiropractic in Lacey, Olympia, Washington. Thank you for watching, guys. You're a local Seattle, Tacoma chiropractor. I'll see you soon. Watch for my next video. Bye-bye.